Okay, I think we'll get going now. So thank you everyone so much for joining. My name is Dr. Alex. If you don't know me, I know that some of you are patients of Dr. Colby. So Dr. Colby and I run Haven, and Haven is basically an all virtual holistic medicine practice where we work with people who really like to take responsibility for their health and maybe doing a lot of the things right. It's not for want of trying or not for want of changing your diet, but you're still not finding the results that you expect with all of the changes that you're making. And there's reasons why anyone doesn't experience the health results that they're expecting when they're making changes. And that's really what I want to talk about today, because the laws of nature are rational. The laws of healing are rational. It's not a big mystery that we have to solve with greater and greater technology. Okay, this is common sense stuff that anyone can figure out if they understand the roadmap of how nature works and how the body heals. Okay, so that's the talk today. So I want to make sure everyone can see this. Are you seeing my my screen here with the slides? Could I get a thumbs up? Okay, great. No technical difficulties so far. Incredible. Okay. So this is kind of a new patient orientation because we really want our patients to understand what they've signed up for and kind of the basis for what we do. But really, this is more of a general talk for anyone to understand, how does healing happen? Okay, so this is like the tell-all talk that explains where Colby and I are coming from and why we built the practice that we built and why we do what we do. So what is missing from conventional and most alternative healthcare approaches that leads to poor results? Why do people put in effort and make these changes and not feel the way that they want to feel? There's three reasons I'm going to talk about today. Number one, the foundational pillars of health are not in alignment. These foundational pillars have been around for literally thousands of years. They've been known about and worked with in various holistic medicine systems throughout the ages. Okay, and they have not changed, even though our modern lives have really changed a lot. Number two is a coherent, time-tested roadmap for healing. We're not just throwing tomatoes at the wall and seeing what sticks. We're not following trends and fads and getting lost in the weeds with the ever-changing landscape of the cultural, fads and trends that are happening. We are following a system that has been developed over literally hundreds of years. And we stick to that, and that's how we know that we're on the right track and that we're on the healing path. And number three, using individualized testing and program design to figure out what's right for each person so that you can truly individualize and you're not fitting people into a box. Okay? So we're going to talk about all three of these today. So let's start off with some basics. There's two major approaches that are used in our healthcare environment today. The first is the allopathic perspective. Allopathic is another word for the conventional medical system. Okay? Now, there's certain assumptions that underlie any system that you use for healing. So what we're doing right now is we're looking at the assumptions. We're looking under the hood to understand, okay, what's the philosophy behind the way that allopathic medicine is practiced? So in the allopathic perspective, the body is kind of seen as a machine. It's a mechanical thing that can fall apart, and we need to repair it and put it back together when there's dysfunction, right? it's typically quantitatively based, which means that we use lab values and we use statistical models to understand if someone is not healthy, and we correct those quantitative values to indicate whether we're on the right track. Different systems in the body are typically treated separately. So, similar to if your air conditioner breaks, you call the air conditioner guy. If your plumbing breaks, you call the plumber. If different things in your house break, you call the specialist. That's the way that the body is treated in the allopathic model, right? Different systems are treated differently. So you have a cardiologist who works at your heart, a pulmonologist who works on your lungs, etc. Typically, the main therapeutic technique is to suppress the symptoms that you're experiencing. So if you have a fever, we want to bring the fever down. If you have a rash, we want to make the rash go away, right? If you have high blood pressure, you want to bring the blood pressure down. So we want to suppress the symptoms. And it's typically based on a triage model, which means that if you think about a ambulance arriving to a scene and there's different people that are at different states of issues, right? Triage means that we treat the worst cases first. And if someone doesn't have a serious of a problem, they get put down to the bottom of the totem pole. So in an allopathic perspective, when you go to your general practitioner, their primary consideration is that you're not going to die or develop some serious problem that's going to put your life at risk. And if you meet the criteria for that, they're going to send you off to a specialist. Okay? They're making sure that the bases are covered. They're not worrying about people necessarily that don't fit more serious diagnostic criteria, which would, make you a good candidate for medication or some other intervention. So it's a triage model. And that makes sense because, primary care doctors are overwhelmed with people. They can't spend an hour with patients, right? And the model is really based on the genetic theory of disease, which means that we are born with genes that may be good or bad, and that is kind of our lot in life. And if we have bad genes, then we may develop diseases that have to be managed, and we can't do much about that, right? And it's also based on the germ theory of disease, which says that nature is kind of dangerous and may attack us and put us at risk. So we have to use things like vaccines and antibiotics to protect ourselves from nature that's trying to kill us. So I don't want to paint this as a completely bad, bleak picture. Does anyone want to unmute yourself and answer, when would this model be appropriate?
Emergencies.
Emergencies is a great answer, because in an emergency setting, you need to treat the body as a machine and put it back together to save life. Any other responses?
Maybe to diagnose the issue at first, just, when I was diagnosed with cancer, I went to the doctor. I don't know how I was going to be diagnosed if I didn't go to a GP.
Yes. The allopathic system is very, very good at diagnosis because they have this systematized approach where they have specialists in different fields that are highly capable of figuring out a whole variety of different issues. Okay, so correct diagnosis is a great answer. Anything where you want to save life, surgical interventions, anything where you need suppression of symptoms in order to protect the body. Like if your blood pressure is 220 over 180, you need to bring that down in the short term. So symptom suppression and triage and having specialists works very well for acute, dangerous, emergent situations.
Yeah, like a C-section if you're having a baby or you need some emergency, right?
Exactly, exactly. So what the allopathic approach does not work very well for is chronic problems,
Mhm.
because this model has been applied to chronic diseases, which are multifactorial. And that's where we get into the holistic perspective. Okay. From the holistic perspective, we see the body as an intelligent living entity, which means that the symptoms that it produces are coming from an intelligent response to the environment. This isn't just a dysfunction where the body is acting out. It's actually an intelligent organism that's working with the conditions that it's in. It's qualitative based in that the main indication for us is how are you feeling and how is your life actually changing as a result of what we do. That doesn't mean that we don't use quantitative based measurements. Most of you have gotten the metabolic hair analysis that we do. We still look at lab work, but we're really interested in how is your life changing? Because many people go in to a conventional doctor and everything's normal on their labs, so there's nothing that can be done. When really, if you're having symptoms and you feel bad, that's the biggest indication that something's wrong and that we can improve it, okay? In the holistic perspective, we believe in quantum coherence, which means the body is completely integrated and connected at every level, not only every system in the body, but the mental, emotional, spiritual planes are all interconnected at every single level. So we can't just treat one local system, okay? Symptoms are messengers of deeper imbalances, meaning that the symptoms are just the superficial way that the body communicates what's happening on a deeper level. They're not the disease process itself. So a fever is an attempt to heal an underlying imbalance. A fever is not the issue. So suppressing a fever wouldn't make any sense because that's just suppressing the messenger, right? Unlike the genetic theory of disease where people are born dysfunctional, in the holistic perspective, health is your natural state. It's your God-given natural state. We all evolved on the planet to thrive. So even if you have a genetic disease, like a true genetic disease, you can still optimize your health to a huge degree. We're all designed to be healthy and live on the planet in a healthy, balanced way. And disease is an intelligent response to a violation of nature's laws, meaning that it's not mysterious. If we violate the nature's laws that are basically the God-given laws on the planet of how an organism should function in a healthy manner and interact with the environment, if we violate those laws, disease is going to be the natural outcome. Okay, so it's commonsensical. And this model works very, very well with chronic problems that are multifactorial, right? So the principles of naturopathic medicine, which we could just say holistic medicine, have their roots back as early as the late 1800s with a man named Henry Lindlar. He was the father of naturopathic medicine in our country, in America. I know we might have some people here from Australia, actually, which is great. So we're global here. So the main principles of naturopathic medicine are, number one, we need to detox the body. Number two, we need to improve the nutrition so the cells get all of the nutrients and building blocks they need to heal. And number three, we have to stimulate the self-healing mechanisms of the body, because the body is an intelligent, creative force, and we can stimulate the body into action so that it can heal faster. Lindlar produced this image in his book that was literally published in this is 1914. We have all the diseases up here. Here are the branches colds, rheumatoid arthritis, cancer, diphtheria, appendicitis. The trunk is all of those pillars that we just talked about. And the roots of the tree are growing in the soil of a violation of nature's laws out of ignorance or lack of understanding. So if we don't understand nature's laws, then the body is going to become toxic. We're not going to have the nutrients that we need to heal. And the life force is going to be dampened, which is going to lead to disease. So the disease is just a superficial response of the underlying imbalances, right? And here, Dr. Lindlar says, evil is not an accident, not an arbitrary punishment, not always an error of mortal mind. It is the natural and inevitable result of violation of nature's laws. It is instructive and corrective in purpose and will remain with us as long as we need its salutary lesson. What that means is disease is a messenger for us. It's a messenger to tell us that something's not right and we need to go back to the laws of nature to understand where the imbalances are occurring. We have a mentor named Dr. Charlie Cropley, and he always used to say, the cavalry is not coming. That means that if we consciously or unconsciously, and oftentimes it's unconscious, we don't know any better. If we violate nature's laws, no one is going to help us to correct that besides ourselves. We need to take responsibility for that. No one can save us from this. The way that we live our day-to-day life makes the difference in whether we're healthy or whether we're sick. And that's really what Dr. Lindlar is saying. Okay, so the first point here is, what are the foundational pillars of healing? We call this the four-legged stool. We have detoxification, nutrition, vitality. These three came from Dr. Lindlar himself. And then the fourth one, which he didn't exactly articulate, but has always been around for centuries, is the mind-body connection. So these are the four pillars that all human beings need to be healthy. And depending on who you are, depending on your life circumstances, your imbalances, your lifestyle, we might need to focus on any one of these more or less. But we all need these four pillars. We kind of compare this to like taking care of house plants. All plants need nutrients in their soil. They need water and they need sunlight. But some plants need more drainage. Some need more fertilization. Some need more sunlight, less sunlight, more water, less water. So humans are like house plants. We need the basics, all in different ways, depending on who we are. Okay. So we're going to go through these pillars quickly, just so you understand the basics of these. Pillar one is detoxification. I like to make detoxification really simple so we don't get caught into these like, the things that you read on Instagram about detoxification, which are oftentimes like way off base. Detoxification is a matter of, are we eliminating toxins more than we're absorbing them? If our elimination of toxins is not adequate, then they're going to build up in the body, because where else are they going to go, right? And there's many places that we discharge toxins. All of these discharges, our stool through our digestive tract, our urine, our sweat, mucus through our lymphatic system, our breathing, menstrual blood, and even emotions are all discharges. But what happens is, with a lot of the therapies that we do with both conventional pharmaceuticals and even natural therapies, we actually suppress these discharges. So if someone has diarrhea, we suppress it, right? You suppress sweat with antiperspirants. You suppress your mucus with antihistamines. You suppress your menstrual cycle with birth control. And you suppress your emotions with psychiatric medication, like anti-anxiety. So we're suppressing the body's attempt to deal with the toxic burden and the elimination process. So a big part of all holistic healing is supporting these channels, opening up these channels, supporting the movement and the flow of toxins, decreasing the toxins that are coming into the body, improving the metabolism so it's not producing as many toxins, and then opening up the channels. Okay, so that's pillar one. Pillar two is nutrition. What part of your body is not 100% made of what you eat, drink, breathe, absorb, and think? Your cells are remade constantly. The slowest cells that are remade are in your brain. Those are remade every 8 months, but they're still remade. Your skin cells are remade. The cells of your digestive tract turn over every like 4 days. Your red blood cells every 3 months. So your body is consistently being remade. How is it going to remake itself if it doesn't have enough nutrients? And what we're experiencing in the modern age is a big nutritional problem because our soils are becoming depleted. And on top of that, we're losing traditional foods that we ate for millennia, like organ meats and bone broth and raw milk. So you can see how much of the nutritional density we're losing with our modern food, which means we have to try that much harder to get all the nutrients we need, not only by eating high quality food, getting food from local farms, choosing better, more nutrient dense foods like animal proteins and seafood and liver and bone broth and milk, and also taking supplements, because there's great whole food supplements that we can use to benefit us. And that's one of the benefits we have in the modern age. One of the biggest influences of our nutritional paradigm comes from the work of Weston Price, who is a dentist that traveled around the world in the 1930s and compared people in the exact same geographic location. So for example, he went to New Zealand, compared the people that were living in New Zealand in the jungle, off the land, versus people that were living in cities and eating the modern produce and products that were made that were being shipped to the cities, like canned foods, pasteurized milk, white sugar, white flour. And he took a bunch of pictures of all the individuals that he studied and found that if people eat the traditional food off the land with high amounts of animal protein, high animal fats, and nutrient density, their teeth are beautiful, perfect, no dental infections, beautiful jawline, no crooked teeth, big facial structures, no chronic disease. The same people, which means the same genes, the same genetic population eating industrial food, they develop cavities, crooked teeth, developmental issues, and chronic illnesses. And I always like to say to people, imagine even in our modern culture, the first world culture, if we didn't have modern dentistry, what people's mouths would look like. I mean, I had like 20 tooth infection, what do you call it? Dental infections when I was like 10. I had crowns put in, crazy. And I mean, I was raised on fruit roll-ups and toaster strudels, so it makes sense, right? So Weston Price, he actually quantified the nutrient density in the foods that he was studying of these different groups. And this is a comparison of the percentage increase of all of these minerals and fat-soluble vitamins compared to the 20th century diet. And this was actually done in like the 1970s or 80s. It's probably worse now, meaning that people, people living in the Swiss Alps had 370% more calcium in their diets than modern people. So like we're eating way, way less nutrition than our modern or our ancestors. And this is only like 100 years ago. So things have really changed dramatically in the industrial age. Pillar 3 is what we call vitality or lifestyle. The idea is we evolved over millions of years to live in harmony with this planet and the conditions on this planet. And despite our modern lights, our crazy busy schedules, living in cities, these conditions have not changed. So these are the planetary conditions that we evolved with. Clean, structured water that's energized. Sorry, my mouse can be a little fidgety. Clean, fresh air, toxin-free environment. Bathing in cold water, because doing hot showers all the time really devitalizes the system, right? Good natural movement, which includes walking. I mean, walking is like the basic exercise of humanity for thousands of years. That's an amazing exercise, is walking, right? Community living, like living and supporting each other in communities, which has become harder and harder these days. Direct contact with the earth, with your feet on the earth. We call that grounding. The whole earth has a whole magnetic field that discharges the positive ions that build up in your body, because your body is literally an electrical battery, right? So direct contact with the earth, 24-hour light and dark cycle, right? Which is, again, challenging with all the modern technology. We have modern lights, screens, etc. Monthly lunar cycle, which particularly for women, most are disconnected from. Naturally, you know, women would align their cycle with the moon, with the lunar phases. But with birth control and all the hormonal imbalances, we're very disconnected from that. And the 4 seasons and eating locally in seasons. So we want to align ourselves with the planetary conditions, right? And then number 4 is the mind-body connection. So important when it comes to chronic illness, because our psyche affects everything. This is a diagram that kind of shows the hierarchy of how things travel from the spiritual plane to the physical plane. At the deepest level, your soul is perfect. It's complete. It doesn't need anything added or subtracted to it. That is your God-given natural right. You being a soul on the planet is justification enough. You don't need anything else to prove your worth. But when things happen to us, particularly in childhood, traumas, negative experiences, repetitive patterns, we develop beliefs about ourselves that aren't actually true on the deepest level. Like, no one really loves me. No one understands me. I'm going to be alone. I'm going to be sick. All these things that then run like operating systems running in the background. So even if we clean up our diet, we take good supplements, we do all the therapies, if we're still having these thoughts that are continuously talking to ourselves, how much you don't like yourself, or all your fears, you know, all your insecurities, that's going to continuously create a blockage of the life force coming through and healing the physical body. And we see this all the time with chronic illnesses, because we're psychological beings. It makes sense, right? And when we have a chronic problem, we can get kind of stuck in that place, and that can create a limiting belief about who we are. So we always want to not just give lip service to the mind-body connection, but really address it, because this, over almost anything, is completely transformation. Because if you align yourself with God and with the universe, anything could happen. your cancer can be cured like that. So a lot of people give lip service. It's like, yeah, we get it. It's important. But like, this is really important. So like, we should work on this all the time. Okay. So we have in naturopathic medicine a therapeutic order. This is kind of getting to pillar 2, the roadmap of how do we heal. When we create a program for someone, we want to establish the foundation first, because you can't build a house on a faulty foundation. A lot of people go to other alternative practitioners, functional medicine doctors, and they're working up here, supporting weakened systems and using natural symptom control, replacing some, medications for supplements. Like, instead of using this medicine for migraines, take this supplement for migraines, right? Instead of taking this anti-inflammatory pharmaceutical, take turmeric. It's not to say that turmeric's bad, but this is just natural symptom control. This is higher up in the therapeutic order. And that's the reason why a lot of people don't get results, because they're doing a lot of things, but it's way up high here and there's no foundation. The foundation's the 4 pillars. We want to create the foundation with the 4 pillars, stimulate the body's self-healing mechanisms, support weakened systems. And if we need to, we keep working up the ladder. And sometimes we have to do that. There's even a place for surgery and pharmaceuticals, of course. You need to give someone the care that they need in order to keep them safe and create balance in the short term. But without that foundation, you're not going to see the long-term results that you expect, right? So that's the therapeutic order. Now, here's a really helpful diagram to understand the healing process. We start with normal health. Remember, we're designed to be healthy. We have disturbing factors. What are those disturbing factors? The 4 pillars. We're not getting enough sleep. We're staying up way too late watching TV. We're dehydrated. We're not getting the nutrients we need from our food. We're eating food intolerances. We're taking in too many environmental toxins. We have mental negative thoughts running through our head. These are all disturbing factors. That's going to disturb our normal, natural state of health and create a disruption and then a reaction. And what the old naturopathic doctors used to say is that all acute illnesses, this is brilliant. I want everyone to just let this sink in for a second. This is so amazing. And we're not taught this, okay? All acute illnesses are the body's attempt to detoxify and heal itself. All acute illnesses. That means the infection that you feel like you picked up at the party that you went to is still your body's vital force throwing off toxins. And I don't know about you, but oftentimes when you go through an acute illness, you feel better afterwards, like in a deeper way, like you got rid of something in a deep way and you are better now. Many people are too sick to actually get sick, meaning that they're too chronically low energy to even develop an acute response. So the next time you get a fever, you should bless your body for that, because that's truly a sign that your body's vital force is very high and it's trying to put itself back into balance. So what happens with that acute reaction, fever, inflammation, is that there's a discharge process, right? We talked about all the channels of elimination: mucus, vomit, stool, urine, sweat, emotions. We discharge, we get rid of the toxins, we get rid of the disease energy, and we return to normal. Now, if the disturbing factors aren't changed, that acute reaction is going to turn into a chronic reaction. And you know what happens is we typically don't change the actual reason why it happened in the first place. And then we actually suppress the healing process that the body is trying to do. So we're not changing the foundation, and then we're suppressing. And that's going to drive us into a chronic reaction. And if that continues, that's going to drive us into degeneration. A classic example of a kid grown up in a first world country is that they are born, they get all these high fevers and rashes because their body is trying to discharge the toxins that accumulated over, the generations that were passed on to the child. And the child's vital force is so high, it can throw off those toxins really well. But what do? We suppress the fever, we suppress the rashes with steroids, keep suppressing it. Then the kid develops asthma. Then we suppress the asthma with corticosteroid inhalers. And then the child develops an autoimmune condition. And then we suppress that. And then they develop something worse. That's how, see, this isn't some mystery. This makes sense because if we understand the roadmap, then we understand why things happened. So what we need to do to heal the body is we need to, change the disturbing factors, create the conditions for health, open up the channels so that there's no suppression. If I get a little feedback. If everyone could please mute yourself, that'd be wonderful. Thank you. Okay. So number 3 on the 3 points I laid out in the beginning. How do you individualize? In the allopathic model, the main way that we figure out what treatment do you need is we use your diagnosis, lab values, and then we put you on some protocol based on your disease, right? In the holistic model, we understand that there's metabolic differences between individuals, acid-alkaline balance, sympathetic, parasympathetic, food intolerance differences. There's lifestyle factors that need to be addressed that are different for each person. Very different conversation we have if I'm working with a mother that's a stay-at-home mom with 4 kids versus a consultant that works 80 hours a week, right? So we need to understand the lifestyle factors, the mind body of the person that we're working with, the underlying imbalances, like what are the organs that are stressed? What are the deficiencies that are on board? What are the toxins that are on board? And then we use specific bioresonance testing to figure out what each person needs. There's a ton of great supplements on the market. How do you figure out what each person needs? How do you figure out what foods are good or bad for someone? We use bioresonance testing to address what is helping or disrupting your bioenergetic field, which is like your life force. And of course, we still use diagnosis. We still use lab values. They're put into a model that takes all of this into account. So one of the things I wanted to briefly talk about was our food intolerance evaluation, which of course, if you know us at all, you know that this is a big pillar of what we do, right? This evaluation is literally 100 years old. And the technology has changed very little over the course of those 100 years. It was developed by a man named Otis Carroll. Dr. Carroll was a student of Dr. Henry Lindlar. Henry Lindlar is the father of naturopathic medicine. And he's following the principles that Dr. Lindlar laid out, but he wasn't able to help his chronically ill son. What Dr. Lindlar said is that everyone, for the most part, should eat vegetarian. And the vegetarian diet was very, very popular culturally during the turn of the 20th century, the early 1900s. And it wasn't his fault for thinking that. Vegetarian diets are very detoxifying, and they're very good to address the modern industrialized high animal product diet. But we know that the diet can be individualized based on metabolic differences and food intolerances, right? So Dr. Carroll consulted with some of the best scientists and doctors of the age. First off, I love the classic scientific genius pose that we have going on here. Like if you get a photo taken of yourself with this pose, your IQ just skyrockets. So we have Dr. Albert Abrams. He was the director of medicine at Stanford University in California. And we have, of course, the infamous Dr. Nikola Tesla, who really expanded the way that we understand energy, electricity, how our body is an electrical being interacting with the electrical nature of the universe. And with Abrams and Tesla's technology, Carroll devised a method for assessing food intolerances. This is literally the same technology that we use for our food intolerance evaluation and the bioresonance testing that we do. It literally uses Tesla coils, Tesla technology, to assess each person's energetic field, their life force. And through that process, he figured out that his son was intolerant to fruit, which he always thought was a perfect and healing food for anyone. I'm sure there's some people on the call who are intolerant to fruit on this call, so we feel your pain, we get it. The first patient ever to do the food intolerance evaluation was fruit intolerant. That's probably the only reason why this took off, because this blew Dr. Carroll's mind. He had no idea that that would even be possible. And what happened was his son completely healed. Dr. Carroll became one of the most famous naturopathic doctors of his time. He was said to have the largest sanitarium, the largest clinic west of the Mississippi. And there's a lot of great things that some of the most famous naturopathic doctors said about him. Premier figure in the history of the American naturopathy movement, one of the most significant naturopathic physicians of the century. So we're coming from a lineage here of a time-tested, tried and true method that started with Dr. Carroll. He taught it to Dr. Harold Dick. Dr. Harold Dick taught it to his daughter, Dr. Letitia Dick, and our mentor, Dr. Jared Zeff, and they taught it to us. The reason why I'm saying all this is to show that what we're doing here isn't some like new cultural fad. Like this is something that's been done for 100 years and has had amazing results. So I want to go over some cases. I know that we're getting close to the top of the hour. I'm just going to go over these briefly because I want to crystallize these concepts for you. I want to talk about our patient, Christina. She was 36 years old when she came to see us, living downtown, working in marketing, very interested in health, and really took care of herself, going to hot yoga, berries, boxing, walks everywhere, very conscious about her health, still had issues. Consistent weight gain, no matter what she tried, calorie restriction, cleansing, high intensity exercise, chronic digestive issues that manifested as abdominal pain and diarrhea, fatigue to the point where sometimes she couldn't get out of bed and she had to call off work, and hormonal imbalances, which she tried so many different specialists, no one could figure out what was going on. She's having hot flashes, restless sleep, etc. So she tried multiple MDs in San Francisco, went to multiple alternative clinics that did lots of functional testing, didn't lead to anything, and then went to another alternative health center in Chicago, food sensitivity panels, cleanses, calorie restricting, didn't help. We made sure that her body was detoxified, which wasn't really considered in a healthy way. Calorie restricting and binge dieting is not the way to detoxify because you're working against the body. So we did gentle detoxification. We made sure that we upped the nutritional density because she has this history of calorie restriction. So we got her on some good supplements for endocrine support, traditional foods, and strategies to improve her blood sugar, which was all over the place, which was perpetuating the hormonal imbalances. One of the biggest things we did was just have her slow down because all this hard exercising was actually putting her body more in stress. So she literally stopped doing all the HIIT workouts, like dramatically reduced them, and started doing yoga, walks on the lake, and it did sleep practices to improve her sleep. And then nightly journaling for self-reflection to decrease stress and mental emotional stuff. Today, hot flashes are gone, stomach issues resolved, normal stools, feels way more balanced, noticeable amount of weight loss, but she doesn't check herself on a scale, which I think is brilliant. And she walked into my office and I was like, you look like you're glowing. I mean, she looked like a totally different person. We did basic stuff, but the foundation wasn't being addressed, right? So we made sure that we addressed that. Next patient, Gloria. Gloria was not, I almost said 94 years old when she came to see us, 49 years old when she came to see us, living in Southern California on her family's orange grove, and she helps with the operations there. Single mom raising 5 kids, very interested in health. She actually began the Gonzalez protocol that we do for cancer at our clinic as well, for stage 4 breast cancer in the mid-90s, and she reversed it. Amazing. The Gonzalez protocol, incredible program. We have others on the call that are on it as well. And tried and true method of reversing cancer at its root with diet, supplements, detoxification. So she reversed it, does yoga and dancing for fun and for health. Despite being on the program, a long history of family stresses seemed to bring the cancer back because pain was coming back, and you know, health dysfunction was kind of coming back. We're having these episodes, these deep bone pain episodes that would basically incapacitate Gloria, and it would be hard for her to get out of bed. She was also struggling to stay compliant with this rigorous program because it's a lot. And she had all these other things on her plate as well, like, you know, raising her family and work and things. Ongoing family stresses, work stresses, and depression. So despite all that she was doing, things were kind of going backwards a little bit. Okay. So what did we do? We identified some further sources of inflammation that hadn't been originally identified. Her intolerance was egg. I implemented the 80-20 rule with Gloria because she was trying so hard to be perfect with the program, and it was making it really hard for her. And then she'd kind of be like, well, screw it. You know what I mean? Like, it's hard for me to do. So then it would just lead to even less compliance. So the 80-20 rule, like being able to live a normal life and make this sustainable for yourself, so important. And Gloria was feeling bad about like eating a cookie every once in a while. I said, Gloria, you can have a cookie. That's fine. Right? So we implemented the 80-20 rule, and her ability to do the program actually got better because she was not being so hard on herself. So she created more space. We really prioritize me time because Gloria has a thing where she worries about everyone in her life, all of her kids, her father, her, you know, everyone, and not herself. So we prioritized herself, and we implemented specific remedies to help the healing process, to stimulate the healing process. And then finally, we did holistic counseling to uncover some of the deeper mental, emotional things that were going on that were really aggravated with the family stress, and kind of brought that all back to the surface. And we're talking like long-standing false beliefs about who I am, my relationship with my family and the people that I love. So we did very deep counseling work. Since we've been working together, the bone pain episodes are much less frequent. And when they do come, it's, you know, Gloria is not perfect. No person is perfect. I've had chronic digestive issues for years, and they still come back. I get bloated sometimes, I get constipated sometimes. It's not about being perfect, but it's happening less frequently. And when it does come, Gloria has a better understanding of what to do about it. There's less fear and anxiety around illness in general. She's prioritizing herself. She understands how her internal dialogue and false beliefs are perpetuating issues. And there's less perfectionism and more balance. Wonderful, wonderful. And then Lonnie, we have Lonnie, 40 years old when she came to see us, living outside of Indianapolis with her husband, Todd. She owns her own hair salon, which she's been operating for over a decade. travels all over the country in a souped up camper, does a lot of training for various swimming races and races that she competes in. And she loves cooking and actually organizes this event called Tables for 10, where she gets small groups to like go out to eat or cooks for them. So Lonnie was actually diagnosed with MS, multiple sclerosis. And she was feeling numbness in her hands, which obviously as a hairstylist is a big deal, right? And this was really scaring her because multiple sclerosis doesn't have a cure. And usually all you can do is slow it down, but it keeps getting progressively worse. She's also having difficulty losing weight despite lots of exercise and a lot of stress around work and family. So what did we do? We identified ongoing sources of inflammation. A huge one for her was that she's meat intolerant. And she's a big foodie. Her husband has a smoker. They like smoke meat every day. And she's meat intolerant. So that's perpetuating the inflammation in her body. We really prioritize vitamins and minerals for MS healing to regenerate the nerves that were losing function. And we did that through supplementation and also nutrient-dense foods like dairy and marine collagen. We had to be, creative because she can't eat meat. So we had to get other sources of animal protein in. Vitality, lots of stress with job and family. So we implemented a 1 day a week for just Lonnie. No work, nothing on her schedule. She'd get massage, she walks the dog, journals, meditation, prayer. And she also decreased the hours that she was working every day because she owns her own business, so she could do that. And finally, we did a lot of counseling around long-standing childhood stuff, like deep childhood wounds when she was made fun of as a child and things like this. And we, implemented remedies to help move the stuck emotions. Today, hand numbness is barely noticeable. If you were with a neurologist, they might say that's impossible because MS can only be stopped or slowed down. It can't be actually reversed. Her self-love for herself has grown tremendously. Her awareness of herself and her love for herself, it's just blossomed, which is beautiful. And she's got so much more self-awareness. She understands when she's perpetuating these problems in her life by driving them with her thoughts and her beliefs, and then acting out of that limiting state. She understands her past emotional traumas, and she's creating the life that she wants by prioritizing what she really wants. Because before, she's running like a chicken with her head cut off, working too hard, doing all these things, when really that's not the life that she wanted to live. So it's like, why are we living like that? So we just brought it back to the basics, guys, just the basics. And we were able to reverse the MS process. Amazing. Okay, so thank you so much. I know that we went a bit over. Thank you so much for your patience. I would love to hang around and answer any questions that anyone has. Feel free to unmute yourself and ask any questions or write them in the chat. Okay.
Thanks, Alex.
Yes.
I appreciate it.
Thank you, Bill. Thanks for being on the call.
Yeah, it's good. Good stuff.
Good. Good, good.
That mind stuff, I think, is my biggest deal. I'm working on it and trying to always think about how I can get rid of the stress from every part of my life, and add more fun things in instead of just nothing fun all the time, so see what happens.
Yeah, man. I mean, you and everyone else, right? Like I always feel like the biggest disease of the modern age is just chronic stress and overwork.
Yeah.
It's like, what are we working so hard for? Are we ever going to enjoy our lives and smell the roses and have fun with our kids and,
Yeah.
So yeah, I mean, lifelong, it's a lifelong journey. So it's awesome that you're becoming aware of it.
No doubt. No doubt. I guess you're getting other questions. How
Yes.
do I get the test?
Okay, let's see here. So we have one from Brenda. Thank you for the presentation. Thank you, Brenda. If you took the food intolerance test twice, would you get the same result? Great question. Almost always, it's the same result. Almost always. Very rare situations where it will change. Some examples where it could change is if you get a blood transfusion, because then you're literally changing the vital energetic field of your body because it's blood from someone else. But that's one of the greatest benefits of the food intolerance evaluation, is that the results typically don't change, because we're really looking at your constitutional pattern, your constitutional enzyme deficiency, you can say, that's preventing you from digesting foods appropriately. So it does not change typically. Okay, and we also have a question from Felicia. How do I get the test for the food intolerance? If you're a patient, we can talk about getting that for you. If you're not a patient, you can order that at our website directly, and we'll ship you a kit. Super simple, little finger prick, smear some blood on the paper. There's a return label in the kit. You send it back to our office and we send you the results. Super simple. We have a question from Annie. Alex, how did Western civilization become so removed from holistic practices? What a great question. I think that's probably a more complex answer than I can give right now. I think if I'm going to be completely transparent, there's economic reasons for that. There's political reasons for that. There's cultural reasons for that. And I don't think that shouldn't be a surprise for most people on the call. I mean, medicine is a big business and there's a lot at stake and there's a lot of marketing. And, a lot of people might still have the impression that because conventional medicine is so ubiquitous and so advanced, these huge hospitals, these huge technological leaps in equipment, that it must be better. Because if it's free market capitalism, then the consumer chose the better option. But I don't really think that that's what happened. And you can read about the history of medicine in this country, and there's political reasons why things were suppressed. But if we want to talk less conspiratorial and more just spiritual, I think that as the Industrial Revolution kicked off, we just lost touch with our connection to nature and the connection to ourselves. So I think that there's probably multiple reasons for that, but living a holistic life fundamentally means reconnecting to yourself, which means that you have to decrease the distractions in your life that are running the thoughts like crazy in your mind, always pulling your attention this way and that, never a moment of peace, never a moment of just looking around and enjoying the day and listening to the birds chirping outside your window.
Yeah.
Like, we got to slow things down and connect back with ourselves. And I just think that we lost that with our technological advancements. So that's a short answer to probably a more complex question. Felicia, ship me the kit. Okay. Okay. Colby asked, what is one mind-body practice that you have found to be most useful in your healing journey? I think that, kind of going off of the point that I just made, anything to slow it down. So I like to meditate. I like to just literally sit in my living room or on my porch in the morning with a glass of lemon water and just don't do anything. No music, no podcast, no phone. Just sit and enjoy the morning. That way you can let your nervous system kind of go back down to baseline, right? But definitely journaling, anything that gets you in touch with yourself, like prayer, meditation, journaling. I think that this is the foundation for any long-term mind-body relationship.
Hey, Dr. Alex, I have a question.
Yes.
So does detoxification look different for people that have different intolerances? For example, if I were meat intolerant, my detox process is different than someone that has an egg intolerance. Is it different in how it's handled, the detoxification?
That's a great question. There are some
Good question.
detoxification routines that might include intolerances. Like, for example, there's a parasite cleanse that's a complete mono milk diet because parasites love milk. So you put herbs in milk and you just drink a mono milk diet. So that, like, something like that would be an example where the actual routine you couldn't do if you were intolerant to dairy, right?
Right.
But more so than individualizing based on the person's intolerance, we more so individualize based on where the toxins are in the body and what organs need to be supported.
Okay.
So, for example, if you're getting a lot of rashes, the toxins are trying to come out through your skin. So doing things like sweating would be really helpful. If you're having a lot of digestive issues, the toxins are having a problem getting out of your digestive tract. So you want to work with colonics, enemas, castor oil packs to help move the toxins through the digestive tract. So it's really more so like, what direction do we go depending on what toxin are we trying to remove? Like heavy metals are really good with saunas, for example. They come out through your urine, they come out through your sweat. And where are the toxins located? What organ systems need to be supported?
Okay. Thank you.
Kate, you had a question, right?
Yes.
Hi, Kate.
I question. G'day, all the way from Australia.
Yeah. Hey, well,
Going global. I just had a quick question around the monthly lunar cycle. Are you saying that traditionally women would match up their cycles with the full moon? Is that what traditionally happened?
I believe so. I've read a lot about women who consciously can get their cycle lined up with the moon, which seems like that leads to like this deep integration of the energetic pull of the moon and what your body is going through naturally with your cycle. So I don't necessarily think like it needs to be exactly aligned to be for you to be healthy. But it's hard to ignore the fact that a healthy menstrual cycle is like around 28 days, and that's the lunar cycle.
Yeah. There's definitely something there.
Yeah.
For sure. And just the difference between, obviously, women have, their menstrual cycle every 28 days and men don't get that, I guess, that flushing elimination. So obviously the body compensates in different ways for men.
Yeah, I mean, women have a totally different hormonal kind of balance that they're dealing with. So especially with the high estrogen, which makes it difficult for many women from a detoxification perspective, because estrogen is very inflammatory, which is one of the reasons why birth control is so damaging. And, that's one of the reasons as well why women are more susceptible to certain conditions like autoimmune conditions, for example.
Yes.
So I think that it's just a kind of a different situation. Men don't have to deal with that same burden, let's say, of like the estrogen and that whole hormonal cycle. So, the bleeding, discharge is not needed, but, this is why it's so important for women to actually menstruate, which is why, taking synthetic estrogen for a decade and not menstruating causes all sorts of problems. And it's challenging, right? Because like, I get it from a contraception perspective, it's like, it's the best because you just don't have to worry about it then. And there's no denying that. So it's a very personal decision whether you want to be on birth control, but you can't ignore the consequences. And I think it's important to just make that decision knowing the true consequence of it instead of just taking it as just some like passive thing, you know, which is usually how it's prescribed. It's just kind of given out like candy.
Yeah, exactly. I think that the dangers of birth control aren't articulated to people or to women these days. I think it's just like especially in Western cultures, it's like, well, you go on birth control and that's how you manage that for that period. But the damages of it long term are quite, I don't think, well, it hasn't been told. It's certainly not told when you go to the doctor's surgery.
Yeah. Yeah, it's changing too, which is great. Like, I think there's a lot more awareness around that. I have a lot of female patients that I'm helping to get off of birth control.
Yeah.
But yeah, we still have a long way to go.
And does it take it? Sorry, I don't mean to take up all the time,
Sure,
but
no.
does it take a long time for the body to recorrect? If you've been on birth control, let's say on and off for a long period of time, let's say 10, 15 years, I mean, I can imagine that it would take a long time for those hormonal balances to recorrect. Is that?
Yeah, it can take definitely a few cycles. That's what I typically see with women. It takes a few cycles to get things regulated. And, you know, that's the case with healing from any chronic issue in general, is that like it takes a number of months at working at it and that slow progressive improvement. And you can't make the body heal faster than it wants to heal. You can't push the body harder than it wants to go without robbing Peter to pay Paul. Right. And that's one of the reasons why our programs are 4 to 6 months, because that's the time period where we can really see the change really taking off. You know, sometimes it happens faster. Like I had a woman who had crazy hormonal problems. She cut out her intolerance egg for 3 days. She passed a clot that was so big that she thought that she just had a spontaneous abortion. And she had an OB-GYN friend of hers at her house. She looked in the toilet, was like, no, that's just a clot. And after she passed the clot, her hormonal cycle was immensely better. So
Yeah,
that's a discharge, right? It's the body detoxifying. And she was fundamentally better after that. But that's rare. I typically don't see people passing a clot in 3 days. Usually it takes a couple months.
Yeah, fair enough. Okay, thank you.
Thanks, Kate. Great. This is great. Thank you, guys. Other questions? We have a question from Tracy Lee. Hi, Tracy. Thank you. I have friends interested in the food intolerance piece, but if you could say one thing to get them on board with the entire program, what would it be? I would say when you're ready, then you're ready. There's nothing that I don't want to sell anyone or convince anyone. Like when you're ready and when you understand, it really comes from a place of education, right? So, you know, hopefully the message in this webinar, we can continue to speak to people, because I really think it's just common sense. And when you're ready to change, you're going to do it. Great. Jess, you're saying my own experience?
Her own experience.
Oh, I meant like, I think the most convincing part for
Oh,
me personally, like, has been just talking about my personal experience.
yeah. Absolutely. Yeah, the proof is in the pudding, you know? The proof's in the pudding. Yeah, that's all I'll say about that without going into a whole another soapbox. Yes.
Are you gonna do more webinars like this?
Would you
Maybe
like me to?
talking about other things, or yeah.
Yeah, totally. Would love to. We're going to try to do these new patient orientations regularly for us, particularly new patients, but we want to always invite our patients. And, you know, it's a really good, like, Caroline, you got your boyfriend in here. This is great. What's up, man? Thanks for joining. Yeah. Yeah. So great opportunity to bring family or friends, especially people who need more information, who are on the fence about it. And like, maybe you think they'd really benefit and they just need to hear more about it. So we definitely want to do this more often. But yeah, we would love to have regular webinars about specific topics that are of interest. Yeah. Yeah.
Good, thank you.
I
Yeah.
think a deep dive into specific things would be great. It's
Yeah.
part of the education piece. Yeah.
Yeah, we could always do ones around specific disease processes, which, you know, the foundation that we talked about today is always the same. But depending on the disease process, there's different considerations, right? Different detox routines, different deficiencies that tend to happen, different organ systems that are stressed. So that would be great. Any topic, yeah, digestion, hormones, cancer. Yep, we work with people who are dealing with cancer, so we could do topics all around cancer healing. And we would love your feedback. You know, we're just revamping our online platform, Haven House. I'll share my screen quickly. I think many of you have probably been on this platform. So you can always write in the feed in the chat here if there's anything that you want to hear more about. This is a great place to write, you know, your thoughts and feedback, and to look at ongoing content. And you can also see here this little post about Haven being on Telegram. Telegram is a platform. It's kind of like a group chat where you can join different channels. And it's kind of just like a chat feed. It's a little bit more chaotic than this because it's just kind of like a stream of consciousness chat where everyone's kind of talking about different topics. But you can join our Telegram too and be part of that conversation. I'm trying to pull it up here. Yeah. So this is what it looks like. You know, we have like a very active group on here, and we're always posting about ideas and people asking questions. So this is also another great place to, you know, to be involved if you want to like learn more about any given topic, and if you want to give us feedback. And yeah, we can always do any topic that's of interest. We would love to do that. Brenda says skin issues. Okay, we could very much do that. Hormones, yes, yes, yes. Okay, great. Before we go, I want to mention that if there's anyone on the call who's not a patient, or who, if there's anyone on the call who has a friend or family member that they think would want to become a patient, we want to offer 2 slots to become a patient that's going to be open for the next 24 hours. Okay, so here's the process, and maybe Jess, if you could type this in the chat, and we'll send up a follow-up email as well. But the first 2 people to send an email to hello@havenholistichealth.com with the subject line, "Healing comes from within." Healing comes from within. We're going to offer 2 slots that we're going to prioritize in the next 2 weeks. And if anyone joins us in those 2 slots, we're going to offer a free food intolerance to a family, friend, or loved one that we will do on the house. So just email us with that subject line. And if you want to get going, we'll get you onboarded, whether you're on the call, you're not a patient, or whether you want to pass the message along. Okay. Great. Great.
I have like a testimonial if you want to hear it.
Please, Bill. Thank you.
Okay. I had the food intolerance test, as you would know, and for all, I guess the last 30, 40 years almost, I hadn't been drinking milk because I thought I was allergic to it. And you told me I should be drinking milk, but only raw milk. And I should be eating yogurt, which anytime I drank milk or ate yogurt, my nose ran like a flood. It was crazy. And I started getting the raw milk and raw A2 milk and A2 yogurt. And you can explain what that means, A2. And it's completely different. I have cancer, I had cancer and I got an operation and I was down to like 143 pounds, which was terrible. And when I learned about the yogurt and the milk, I started drinking that every day and eating that every day. I've gained 25 pounds since then, which feels really great. And that's just one little thing that's changed since I've been on the program. So it's great.
That's awesome, Bill. Thank you. And that's one of the real benefits of figuring out your food intolerance is that you figure out what's not your food intolerance. And then if you know how to eat that food in a high quality way, like we did with you, then a lot of people can incorporate foods that they've been avoiding for a long time because they thought that that was really the problem, and it's really not. And that's definitely the case. Like, many people think that they're intolerant to dairy and they're avoiding dairy, but they still have all the same health problems. So their health has maybe improved a little bit. Not to say that it hasn't improved at all, but then they still have these like major problems. And that, to us, that says you're not really intolerant to dairy. Maybe it's helping to avoid it in a small way. But when we figure out the real problem, then we can incorporate the good nutrient dense forms of that. So that's awesome, Bill. Thank you. Thanks for sharing.
You're welcome.
Great. Wow, we got a crew here that's still with us an hour and 20 later. You guys are so awesome. You guys are
Good
great.
question.
Felicia, the sun is set in California since we've been on the call. I can see it's darker. Yeah. Jess, did you say you had a question?
Felicia had one more question in the
Oh,
chat.
great. You got to unmute yourself, Felicia. No, you good?
I want to know, everybody has some kind of food intolerance, or is it possible not to have any food intolerance? Have you ever seen anybody that has no food intolerance?
Everyone that we test has a food intolerance.
Okay.
Now, how much that's affecting their health is another conversation, because some people are really balanced, so their body's able to detoxify so well that it doesn't affect them that much. But everyone we check has one. And the reason why we believe that's the case is because it's really I don't like to use the word genetic because I'm not super into the idea that like you can't change your genes, but it's an ancestral passed on trait. And we know that because it's passed on within families. So the children of the parents tend to be a combination of their parents' intolerances. And we see the same intolerances happening within the same ancestral ethnic groups, like Northern Europeans or Muslims or Italians. We see that the same intolerances tend to cluster within certain ancestral groups. And that makes sense because, almost just 100 years ago, we were eating off the land in much more narrow ranges of the local food that was available to us. It's only recently when the entire spectrum of foods are opened up to us. So for literally tens of thousands of years, we were eating off the land in fairly specific niches, right? So it makes sense that we developed traits to be able to digest certain foods better. And that's the reason why everyone that we check has one. Yeah. Brenda asked, would my family members likely have similar food intolerances? Yes. Okay, great. I answered yes. But again, as you go down the family tree, the food intolerances are going to be a mix of your parents. So it can lead to a lot of diversity pretty quickly. But, we've done a family of 6 and every single person was dairy intolerant, right?
Can you have a food intolerance and not have any symptom?
some people are just have really strong digestive systems and really strong detoxification. But you know, the people that we work with, it usually makes a huge difference.
Okay,
It's a
because I
big-
had a nutritionist, a naturopath nutritionist, just told me because I have a blood AB positive, so I have intolerance for milk. She didn't do any test, just based on the blood test, the blood type. Is it possible to? I mean, there's blood types that are allergic to some foods.
Yeah, that's based on the blood type diet, which is more of a lectin reaction,
Mhm.
which, okay, there might be something to be said about that, but in our experience, the food intolerance is so much more important that when you cut that out, you don't have to worry about all the other little things. So really, we're really into like practicality and sustainability. And there's so many diets. It's like every time you eat something, like you're at a restaurant, you have to like pull out your phone and like look at the list of your foods, you know, which that doesn't seem like a recipe for like long-term health.
Mhm.
So we like to say, again, if you do 80-20, if you do 80% of the work and 20% you're not perfect, you eat a little bit off your diet, you have a glass of wine, you have your grandma's lasagna, you go out to eat with your friends, you might be eating a little thing here or there that you're not aware of. That's fine. Because 80% of the time, you're really putting your body in balance, right? So that's our experience with the food intolerance. It just is such a big needle mover that like you don't have to worry about all the other little things. Again, maybe other things can help in a minor way. I don't want to disregard those other models. We just find that it typically you don't need it. You don't need to do it.
Okay, so this intolerance, food intolerance you do is different, not just say what blood type. I'm actually, you're gonna look more
Yes. Yes,
Okay.
we test your blood sample against various foods to see if there's a negative
Uh,
reaction.
Okay, it's not just based on my blood type.
No.
Okay.
Yeah.
Send me the kit, please.
Okay, great. Awesome.
Mm.
Okay, Brenda. Thank you everyone for hanging out. Well, I mean, I'll stay and keep asking questions. I'm honestly a little afraid of finding out my food intolerance. Do you work with any of your clients on overcoming this fear? I don't want to have a poor relationship with food if I have a significant intolerance. Great question. Great question. What I always say to people is the food intolerance evaluation is just information. That's it. You can choose to do what you want with it. Right. And again, this goes to the whole idea of the 80-20, where a lot of people kind of come into their health with a very perfectionistic mindset. Like I have to follow this to a T, which then becomes very daunting getting any new information because then you feel like you have to follow it perfectly. We don't believe that. 80-20 rule. But when it comes to overcoming the fear, what I would ask is what's underlying the fear? Is it perfectionism? Is it fear of being ill? You know, what's going on there? And we can, you know, counsel through that. So, you know, we work with people with like eating disorders. You know, we work with people who have a lot of anxiety, who have tried like tons of different restrictive diets and have like a lot of baggage going into it around food. I can say that's part of my story. I've tried ketogenic diet, vegan diet. I tried the Ray Peat diet, having milkshakes and coffee and crazy things every day. I've done everything. And that burdened my mentality with all of these rigid dogmas and create a lot of fear. So yeah, I think part of the healing process in a deeper way is understanding where that's coming from and having more patience with yourself, more openness, less perfectionism. So it's a deeper, I think it's probably a deeper thing that's going on with that, Brenda. But in general, it's just information. And even if you do it halfway, you're still going to it's still going to be better for your body than not doing it at all. In my experience. Colby, do you have anything to add to that?
In my experience, knowledge is power. So there's many things that I've learned about my own health that I may now understand, but I may not 100% do. And that's a-okay. That's part of being a human on this crazy planet where the laws and the experiences that we have today aren't necessarily set up to be healthy. And so what we try to educate all of our patients about is that the more knowledge you can acquire, the more educated decisions you can make long term. And ultimately, that's healing. Healing's not about being perfect. Healing's about making educated decisions that are in alignment with where you want to go every day. And when you continue on that process, healing happens.
Amazing. Jess says 80-20 rule all the way. Jess has been a long time patient and, just in our circle, and Jess is intolerant to fruit. So anyone who's fruit intolerant can really lean on Jess because she's a wealth of knowledge. And she just completed her nutritional certification in like a very holistic Weston Price traditional nutritional course. So yes, please lean on Jess. Therese, I felt the same before I found out my intolerance potato, but now my relationship with food has never been better. I slowly cut things out and now I rarely crave foods I used to love. Amazing. Great. Amazing. Well, great, guys. We're at an hour 30 here. You guys are so awesome for hanging out. Any last questions before we sign off for tonight? Last questions.
Does it matter how long ago you cut that hair? Because I was supposed to send my hair test into you about a long time ago, and I cut my hair about a week and a half ago. Does that matter?
No
Just go
problem.
ahead and send it in or get new or?
Send it in.
Okay.
We'll do
I'll
it.
get it turned in.
Cool.
Sorry.
Oh, no worries. No worries. All right, guys. Well, we're going to have the recording.